Measles, just a plane ride away. Top 6 reasons to immunize. Number 1, measles can kill. Every day worldwide, about 400 people die from the measles and associated complications. This is 145,700 people per year, the majority of whom are children under 5. Measles can cause serious complications like brain infection with swelling and brain damage, blindness, deafness, birth defects, and miscarriage. Children and adults who have never been vaccinated are at the highest risk to contract measles. Number 2, there is no antiviral treatment. Currently, there is no antiviral treatment for the virus that causes measles. Supportive care consists of fluid and electrolyte replacement and antibiotics to combat the effects of diarrhea, vomiting, and secondary infections. Number 3, measles is highly contagious. The Disneyland epidemic happened because an international traveler visited the theme park one day in December 2014. The spread across the United States was attributed to parents who didn't vaccinate their children. One person with measles, on average, can infect up to 18 other susceptible people. Extreme ease of transmission. Measles can live in the air and on surfaces for up to 2 hours. The mode of transmission occurs when the infected person coughs, sneezes, or shares saliva by sharing drinks or by kissing. Infected droplets can either be breathed in or picked up from a contaminated surface. An uninfected person then completes the infection pathway by touching their eyes, mouth, or nose. Going to the restroom in a public place could be all it takes for the virus to find its way into a human being. Number 4, the rash window. A person can be contagious for 4 days before the rash appears, and 4 days after. The incubation period is from 7 to 21 days, and the rash spreads from head to trunk to lower extremities. An immunosuppressed person may never develop a rash at all. Symptoms and diagnosis. Symptoms include high fever, Koplik spots, which are small white spots inside the cheeks and soft palate, the 3 C's, cough, coryza, which is an inflammation of nasal mucous membranes, and conjunctivitis, and of course the telltale maculopapular rash. A diagnosis can be made by obtaining a serum sample and throat swab. A confirmation is a positive IgM antibody and RT-PCR, which detects the measles RNA. Number 5, the vaccine is safe. The vaccine does not cause autism. According to the group Autism Speaks, a study with 95,727 children found no association between the MMR vaccine and an increased risk of autism. The chance of an allergic reaction to the MMR vaccine is less than 1 out of 1,000,000 doses. Other reported problems like deafness, seizures, altered consciousness, and brain damage are so rare that their connection to the vaccine is difficult to establish. Number 6, immunization is the best way to prevent and control the measles. The best way for a parent to protect their child from the measles is to follow the CDC recommended inoculation schedule. 2 doses are recommended because 1 dose has been found to be 93% effective, while 2 doses have been found to be 97% effective. The first dose is recommended when the child is 12 to 15 months old, and the second dose is recommended when the child is 4 to 6 years old. If the person is an adult of 18 years or older or not sure of their vaccination or immunization status, they should get at least 1 dose of MMR. For an infant less than 12 months that is planned to travel out of the country, the infant should get 1 dose of MMR. Protecting the community, herd immunity. The best way to control measles and protect a community is for the vaccination rate to be above 95% in order to reach herd immunity. Herd immunity simply means enough people are immunized in a community that the spread of the contagion is prevented. This is needed to protect some individuals who are not eligible for vaccination, like those who are pregnant, have a known allergy to a vaccine's component, very young infants, and the ill or immunocompromised. As you can see, in the USA, before vaccination in the 1900s, there were 530,217 cases per year was the average. Measles in 2010, total for the year, 61 cases. Thank you for listening to my presentation.